Okay, hi everybody. I'm going to talk about fetal alcohol spectrum disorders, and I want to say up front, you all know I'm a social worker. I'm not a physician, but I've worked with youth since the early 80s. Was my first time I met this little boy. I was doing my internship. He was about, I think he was 4, and he had FAS. And he was just, he had a lot of he had the facial features, he wore these big thick glasses, and he was just the cutest kid, and he never stopped moving. And I like to tell the story. It ended up well. He ended up being adopted by who I call the calm family. They were so calm, all of them. Mother was, father was, daughter and son, and he eventually became very calm and ended up in this very loving family. However, his situation was not so unusual in terms of children with FAS being involved with child welfare services. So just so you know, this is my passion area. I ended up working with the local ARC in my county in Washtenaw for 3 years with youth aging out of foster care. And one of the things we tried to do was get a diagnosis of FAS or to see if they were on the spectrum, because it really helps to know when they were transitioning. So we would help them to, one, get a diagnosis or be found to be on the spectrum, and we'll talk about that in a minute, and then help them connect with services for people with developmental disabilities, because they often kind of went from the structure of foster care and their care to kind of that proverbial cliff with nothing catching them. One of the things that got us involved was we had a young man call us who was 17, and he had FAS, and he had been placed in a room in one of these SROs on his way to being emancipated, and he was in high school still, and prostitutes were breaking into his room and using it during the day. So we kind of ended up talking with the DHS, and we were able to hook up a way to provide them with some support. Sometimes I think these are the kids that a lot of people would call the bad kids, but I think a lot of what happens with them is that they just don't want to be seen as stupid, so they'd rather be seen as, the class clown in some ways. So I'm going to talk about this. I don't know how much you all know about them, and if you have any questions, feel free to, type them in, and Mike will ask me to address. So, FASDs are not a diagnosis. FAS, fetal alcohol syndrome, is, and that is actually the one of the 4 kind of groups that we're going to look at tonight. We're going to look at all of them. And, of course, they're called by prenatal exposure to alcohol, which means by the woman when they're drinking. People ask me, well, can men contribute to this? And it would not be called fetal alcohol spectrum disorders, but there is some new research coming out about the effect of heavy drinking on sperm and how that might impact a fetus. So the other thing that's happening is the DSM-5, they put FASDs under neurodevelopmental disabilities with alcohol exposure, and so that it's under there. And there is a section where they're developing it to see if they can have more information about it so that it's more used as a diagnostic category for the DSM-5. Which, as I don't know if you all know, is used a lot in community services to get eligibility for mental health services and developmental disability services. They're 100% preventable, and I'm hoping you all know this, but I always do this, say this part because people don't know, and I've actually had people. I'm a doc student. I had a fellow doc student ask me about it because her doctor had said it was okay for her to drink once in a while she was pregnant. And we just don't know, so the best thing is just not to risk it. What we do know is that binge drinking is particularly damaging to a developing fetus, and I've put the definition here on that. But what we also want to stress is that any drinking during pregnancy is potentially harmful. So even, people say, well, what about those wine coolers? Well, they have an alcoholic level in them that, yes, can damage the developing fetus. We also know that women have different, everybody has a different pregnancy. There are different susceptibility due to their metabolism and other factors. So we don't know how much is damaging. So, I always kind of say to folks, why take the risk at all? And as you're thinking about this, just think about what drinking is in our society and why it's been difficult to get this really on the public map, like autism has been. The alcohol industry is very strong, and they don't want a lot of messages out there about this, that drinking can harm developing fetuses. So, the safest course of action is not to drink if you might get pregnant, and that means if you're having sex and not using birth control. They're the leading preventable cause of intellectual disability in the U.S., and they're more prevalent than Down syndrome and autism. And I've posted a list of the references that go with these numbers, and we'll look at some other numbers in a couple of slides. The estimate of 40,000 a year newborns is low. That study is old, and there hasn't been one really done to look at the population in a while. So we think it's more now. They do last the effects last a lifetime. However, people with FASDs can grow and learn and improve and function with proper support. The CDC, of course, recommends women don't drink at all. They caused a little bit of a stir, I think, when they said, you shouldn't be having sex if you're not using protection, basically, if you're drinking at the same time. But given that more than half the pregnancies in the U.S. are unplanned, which that figure astounded me, I had no idea. It's wise to really be thinking about that, and men too. Whoever the partner is, we want to make sure that everyone is kind of helping so that women, are not feeling pressured to drink or they don't have enough information. However, I always say it's no shame, no blame, because if a woman is struggling with, say, alcoholism, we want to try to help them and support them to get treatment. And there's new research that's been going on for a while, but looking at brief interventions that are quite successful in getting women to at least cut back on drinking, if not quit. Women don't know they're pregnant often in the first few weeks or even months, and so they may continue drinking, not realizing that they are pregnant. So that can cause FASDs if they're still drinking in the early years. One of the things, though, that is helpful is if you're dealing with, say, a teen who you suspect may have been exposed to alcohol as in utero. Mothers are much more likely to talk about drinking during pregnancy when the babies are young teens, which John Hannigan, who is a professor at Wayne State, has done some research in this area. And my experience was also kind of back that up, because I would try to get a hold of moms to ask them if we were looking for that information to help with the diagnosis. And they were often willing to talk to me, and I think part of it was when they're babies, they're afraid the babies might be taken away if it's found that they caused the disability, so to speak. So the first time that FAS was used in this country was in 1973 by Dr. David Smith and Ken Jones, and they're at the University of Washington. And it's the most commonly recognized term that we have. And what they saw was they were looking at a group of children who had similar patterns of facial features, growth deficiency, and central nervous system dysfunction, who were born to mothers who drank heavily during the pregnancy. And they remarked that they looked like they were related. So similar to what some of the other syndromes that Dr. Felt and Dr. Hurwitz were talking about, there's sometimes these kids look alike, but they realized, they're not related, they don't seem to have, but they did have this thing in common where the mothers had heavily drank. So they decided, and it was also a diagnosis that kind of involved both the mother and the child. So it reflects the cause of the difficulties rather than the symptoms. And it is, FAS it is listed in the medical conditions. But and like I said earlier, the DSM-5 has put it under as a developing condition that they're looking at for diagnostic criteria. So other diagnostic terminology that gets used, there's no consensus in the U.S. on the terms for the diagnostic descriptions of the effects of prenatal exposure other than FAS. So these other ones, there's still some, people are still doing research on them and coming up with kind of diagnostic criteria. So some people use FAS and some use FAS and FAE. And I don't hear FAE much anymore. We've kind of stopped using that. Pretty much everyone has. But using ARND instead and ARB to diagnose or to talk about these other parts of the spectrum. FAE was coined originally by Drs. Smith and Jones to describe a small group of children who had similar patterns of cognitive difficulties, growth deficiencies, and mothers who drank heavily during pregnancy, but they didn't have those distinctive features, facial features. So now, and then the ARB was coined by the Institute of Medicine in '96 to describe the physical anomalies only, and we're going to talk about what those are in a minute. Partial FAS is if you have 2 of the 3 facial features and the other, along with the evidence of the growth retardation and the neurodevelopmental abnormalities, or a complex pattern of behavior or cognitive problems that's inconsistent with the developmental level, and that can't be explained by family background or genetics or other reasons. And then static encephalopathy is something the University of Washington, who's done a lot of the research around how to diagnose. They use a 4-digit diagnostic code, and so they look at, they kind of give points for different things, and they look at each, the areas that we talked about, and then they give it a, 1, 2, 3, or 4, and then you have a combination of those codes. So you can have quite a few codes that talks about the level of exposure. So one of the things that I want you to take away from this slide is that that whole idea of cognitive delays, including intellectual, are really stand out in the growth delays. So the cognitive delays, though, are 35% in this study of 9,000 women that was done in conjunction with the University of Chile. So they found 101 women who had drank heavily and matched with 101 women who did not drink. And they looked at binge drinking, which we talked about earlier. And the big finding was that the cognitive change in the form of intellectual and language delays may be the only sign of prenatal exposure. So when we have so many syndromes that children can be, present, but this really stands out for this, for being exposed prenatally to alcohol. So trying to figure out how do we recognize these children and youth without the facial features, because the brain impact can be substantial. So researchers are trying to develop a neurobehavioral phenotype because only about 15% of the children show the facial features, but may have, like we said, substantial problems in other areas. So when you look at these 2 brains, what do you see as the difference between them? And I have to say, the brain that was exposed, it was heavy exposure, and the only reason we have this brain is because this baby died. So you can kind of compare prenatal exposure to alcohol. And actually, Sterling Claren, who took the photos, he and Susan Astley are 2 of the big researchers who have developed the diagnostic criteria. So when you look at these brains, you can see that there's a lot of difference in size, the grooves of the brain that where all your kind of neuroconnectedness happens. There isn't a real clear demarcation of where the corpus callosum would reside in the brain. That's the typical brain. Even though that looks like 2 halves of a brain, there's supposed to be a corpus callosum in the middle there that connects the 2 sides of the brain, which is one of the big issues for these kids.
Anne, you have a few questions if you'd like to field any.
Okay, great. Sure.
The first one is from Wayne, and he's asking, are there any plans, either tonight or in the future, to discuss the behavioral and developmental impact of lead ingestion, especially in light of the Flint water crisis and other reports of elevated lead in drinking water in other Michigan communities?
I don't know specifically if anyone's going to bring that up. It's a good question. What I do know is in Flint, They are doing 2 neurodevelopmental tests for kids, all the kids in the elementary school, and one of them does overlap with what you would see in FASDs, which is the problems with executive functioning. So, and I think the other one is language too, so that may overlap as well. But it's worth, it's not an area that I know a lot about, at least the lead exposure part, but we can certainly explore that.
And the other question was from Ramsey. As far as you know, what are the interactions between alcohol consumption and gestation period? And a follow-up question, is there any current research examining the possible interaction between socioeconomic status and prevalence?
The first question, we're going to talk more about what happens with the exposure. That's coming up. The second question, there is one of the big things that the studies that's been out and has been confirmed is that the women who are more likely to drink in pregnancy are women in their 30s who are white and educated. So, so that's one of those studies we've seen. In terms of other indicators of SES, I can look and see if there are other papers out there about that. They come to our attention. If you're poor in this country, you're more likely to be pulled into the public welfare systems and be scrutinized more. And if you have money, you can kind of pay privately. If your child is having trouble in school, then you find a school that you can pay to take them and kind of deal with those problems. So I don't know if that answers your question, but probably doesn't. But let me look into that. So I just like to show this slide because people are really not sure what a standard drink is. So when we talked about binge drinking, we said it was 4 in 2 hours for a woman, and I think it's 5 for men in 2 hours. But so the majority of women report drinking a drink that's larger than, they think that it's a standard drink, but it is larger. And then daily drinkers report consuming drinks that are 3 to 6 times the size of a standard drink. So the majority of drinkers underestimate the number of fluid ounces they are consuming by 30%. So, one example I give is, there's a drink called Long Island iced tea, but it's 4 shots of different alcohol. So it's not just one drink, it's actually 4 in one glass. So I'm just going to go through briefly kind of the diagnostic criteria for FAS and then looking at what they're looking at in terms of recognizing the other parts of the spectrum disorder. Another term that we hear a lot too is static encephalopathy, which will come up as we look at things, and that's another term that you may see in a diagnostic record due to alcohol exposure or alcohol exposure unknown. So the first thing, just so you know, the facial phenotype looks at 3 things right now. The philtrum, which is the groove under your nose, and your upper lip, how thin it is, and then the I can never say this, palpebral fissure, which is the length of where your eye slot basically, and it's smaller. And they've done enough research that they have guides for each of those 3 things that say what's the standard and what's off. And they've also done it, and this was again Astley and Claren have done this. Here you see white children and black children, and I believe they're developing other ones for other ethnic groups, because your lips are dependent on your ethnic background. So the phenotype, it's a 4-digit diagnostic code that requires the presence of the following 3 anomalies. And so what they look at is the smooth philtrum has to rank a 4 or 5 on this lip philtrum scale, or guide. I'm sorry, they call it a guide, and you can see it's outlined here. And then so I guess there are some, and then the other things, I don't have the measurements, but there is a standard measurement, like I said, they use for the eye slit and the lip. So I also want to tell you, before you all go home and look in the mirror, it's, everyone has their own, you have your genetic background, and there's a whole bunch of other stuff that happens to people So it's really, they have to look at everything in combination. It's not just, is your lip thin on top? Some people get concerned. But I imagine if you were all in this program, probably you weren't impacted. So then you have to meet the 3 criteria, as we talked about, the facial features, growth, and central nervous system. And this is, again, is for fetal alcohol syndrome. And so they tell you what the rank has to be, and then it's less than the 10th percentile on the Fisher length for the eye slit, according to your age and racial norms. And then your growth is also equal to or less than 10 in the 10th percentile, and that's pre or postnatal weight. What I forgot, I don't know, is what age they can look up to that, because sometimes people do tend to grow, but people who are severely exposed usually stay pretty tiny, or they'll have some, they'll be smaller than they should be basically throughout their life. And then the central nervous system impairments, which can be structural, neurological, or functional. And again, they would look at the head circumference, and if there happens to be any neuroimaging done, which usually does not happen, they would look for these things. The neurological would be, do they have any problems such as those listed, but that are not caused by some kind of head injury or fever? So they want to, they're trying to connect it, of course, to the alcohol exposure. And then the functioning really depends on how old. So as they get older, you can look more at what's this child's functional ability, and are they at where they should be developmentally. Cognitive disability. Right now, IQ is, depending on where you go, it's right now it's 70 or below. But you may see a lot of folks, like I have a mom who said to me, well, his IQ is 80, but he can't really access it. So that's kind of one of the impressions you may get with someone who their IQ may say, oh, they should be more capable, but they're not. And then the 3 or more functional impairments in these areas. I think I talked about can you organize yourself to get kind of through the day? And again, this is kind of developmentally, you have to look developmentally what's appropriate for the age. We have, there's a camp that's run, a social skills camp that's run out in Macomb County, and we've done some work with them. And when I was out there one time, and there was a little boy who, he had, his motor skills were they had been really impacted. He actually staggered, and that was due to his prenatal alcohol exposure. And then some of these other things, so sometimes these kids look like they have attention deficit disorder, and it's not truly attention deficit disorder, but it can look like that, and it's more, well, and one of the things that's happened is some of the research has looked at, do the typical ADHD medications work with these kids, and they usually don't, because it's not the same syndrome, even though we're still not quite sure, I believe, what causes ADHD. Social skills, and sometimes these children are diagnosed with autism spectrum disorders as well, because they have trouble in some of the same areas, and they may look, or they may have a comorbidly have FAS and an ASD. So partial is, the difference is that you only have 2 of the 3 facial features and growth deficiencies, or the brain, the neurological deficiency in the brain. And then you also would have this complex behavioral or cognitive things that aren't explained, again, by other disorders. So looking at that, and then so I have to, and I put a list of the diagnostics up under on the blackboard, and we'll look at that in a minute. But the clinics, all what they do, they will do genetic testing, because this can be confused with that. And I'm not a doctor, so I'm not, like I said, I don't have the medical background, but there are several syndromes that can kind of look like FAS, and I know they do genetic testing as well when they have someone come in. And then the alcohol-related birth defects are more related to physical disabilities, cardiac, skeletal, renal, eyes, ears, and other minor anomalies. And I've met a couple of youth who had the cardiac, and they had kind of a cluster of cardiac symptoms. I've seen, with the might get like a hearing loss, also vision problems are related, and some of these other things. Oops. The AR&D disorder part is the ones that I worry about the most, because these are the kids who have their brains have been impacted, but they may not show any facial features or other kind of things that would lead us to think that they were exposed to alcohol in utero. So, and these, when I worked with youth, we had a program that we worked with youth who were in foster care as they were aging out, and a lot of these kids were the ones that they hadn't had a diagnostic done, and we were able to get them in to at least see if they were on the spectrum, so that they would have more information as they were aging out, and we could help them get services as a person with a developmental disability. So these are the things that they need to have. So you have to confirm the maternal alcohol exposure because you don't have the facial features. So what you do is try to find the moms and talk to them about what, do they remember if they were drinking during the pregnancy. And as I think I said before, I did have several who did confirm, and we were able to kind of talk about, well, what did you do? And they, I remember one mom told me, well, I'd go out with my girls on Friday night after work, and, I'd have, and we could kind of get at, she would binge drink several times during the week. So, because you want to know, frequency, how much, and all of that to really understand how exposed the fetus was. So the reason that it's important to understand if someone has AR&D is they get, because of the problems with executive functioning, memory, and learning and social behaviors, these youth get in trouble. They do, and they're very likely to be, brought into the fold kind of by other kids and do things they shouldn't be doing. I had one young man who, his friend said, oh, go into Myers and steal some alcohol. So he went in, he stole the bottle, he got caught, and he did it again a few months later because he didn't learn that he's going to get caught. They had a camera that, had, viewed him, and they could identify him. And that's kind of that whole idea of learning from your mistakes. It's not something that the youth and kids have. It's not something prevalent for them or that they understand a lot of times. So that's one of the areas we have to work and try to figure out how to support. So these are the prevalence rates and costs. These are low too. A recent study does show, though, that, and this is Philip May, and he's done a lot of studies, and he's kind of finding, he did studies in Europe, that 2.4 to 4.8% of young children, and these were elementary school age in the U.S., have an FASD, which to me is just astounding. And they did a screening, and then they did a diagnostic on these kids, or they looked at what we just looked at. And then the other thing I want you to know is that the study that Ashley and Claren did of foster care kids found that those kids are 10 to 15 times more likely to have an FASD than the general population. So when you put that all together, some people think up to 70 or 75% of kids in foster care were prenatally exposed to alcohol and have fetal alcohol spectrum disorder. But again, it's not well addressed in our foster care system. One of the things that I try to work on with the Michigan FASD task force, which I'm going to invite you all to come to those meetings because those count as kind of a community activity for you. So the other things, just so you know, we see the primary disabilities are these, and just somebody else who did a lot of research early on was Ann Streiskuth, and so she said, the primary disabilities are these, but secondary are the ones that they're not born with, but it's because of the functioning that they, have between the person and the environment. So these youth are more likely to be involved in the criminal justice system or juvenile justice system, and I did a lot of work with them too, between the courts and them, and trying to figure out how you help someone who has a memory problem remember to go to their probation, or do things like that. And then my friend Dan Dubowski came up with this too, and he was at the FASD Center of Excellence. And he had adopted a boy who had FASD. And he wants us all to remember that we can't just go at this as totally a deficit model. And what he says here I found to be true too in the years I've worked with youth with FASDs. And they're very important because they do have points of insight. And you can help them understand what's going on and how they can better manage their environment. One of the things that I always do is I assume that the person is doing the best they can with the brain they have, and with the right support we can help them do better. And that it's remembering that FASDs are a brain-based disorder. Some people, they may come off like they're intentionally trying to kind of get you to be angry or be oppositional, defiant. And what I think is that it's really that they're overwhelmed by requests for information. I know one young man was in prison, and his mom said they called her because they knew he had some kind of disability. Or no, he told her the story that he was standing there and a guard came up behind him and kind of barked an order, and then he didn't respond because there's this kind of lag time sometimes with responding, being able to understand what you were asked to do and then respond to it. And so he barked the order again, and then the guard just kept after him. At that point, his brain was overwhelmed, and he didn't know what he was being asked to do, so he got in trouble. And then I put these resources under the resources on Blackboard, and I love to talk about this, and I would love it if you would, if you want to know more about FASDs. I have a lot more information just about how people, we work with people to get them to be more functional.
One last question from Wayne.
Yes.
Some of the focus might be on how to prevent FASD, with the obvious goal being how to encourage pregnant women to acclimate or greatly curtail alcohol consumption. Also, if a mother has one ASD child, she might be a candidate for having another ASD child unless she changes her alcohol consumption. Right. Yeah. So some of some of the research and some of the practice that's being asked is if someone has a child already that has an FASD, they do try to work with her on finding out if she drank during this pregnancy, how can they support her to cut back or stop. That's it, Ann. Okay, great. Thank you so much.